for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. Just like the intro said, I should have just let the intro go. We're going to be talking about getting back to the basics. I'm not going to bore you this evening with my definitions and then let the doctor correct me. We're going to be talking about getting back to the basics of cardiology with Dr. Michael Chizner. And this is a very timely show because February is right around the corner. It's American Heart Month, and that's one of the biggest observances around in healthcare by far. You know, the October's big, November's big as well, but I don't think it's big as February or May, American Heart Month, and then American Stroke Month in May. So without further ado, I want to welcome Dr. Michael Chizner to the program. Dr. Chizner, how are you doing this evening?
Fine, thank you for having me.
And thank you for joining us on this adventure of health. You're an interventional cardiologist, but like I said, let's get back to the basics. What's the difference between high tech, we talked a little bit about this, but the listeners didn't hear, versus high touch? You're very high touched, a personalized approach.
Yeah, I think where we are in medicine in general and in cardiology in specific in 2019, we're at a crossroads, David. Mm-hmm. On the one hand, we live in an era of high-tech medicine. We have CT scans and PET scans and cardiac MRI and nuclear images, angiograms, echocardiograms, great stuff. There's only one problem. On the other hand, we can't afford it. We live in an era of cost containment. We live in an era of managed care. At no time in the history of medicine has the need been greater than today for us to understand what's necessary and the growing need and importance of a well-trained clinician. A clinician is an individual who can use their own senses of sight, inspection, or of touch, the so-called laying on of hands, palpation, of listening, auscultation, with the use of a simple but wonderful instrument called a stethoscope, to make rapid, accurate, cost-effective diagnoses every day in the hospital, at the bedside, or in the office or the clinic, without having to be so over-reliant, so over-dependent on technology. It's not that technology isn't wonderful. It is. It's propelled us into the forefront of the diagnosis and treatment of not just heart disease, but all diseases. But at a time when we're thinking about the rising cost of healthcare, we're worried about unnecessary tests, potentially risky tests that are harmful to a patient who may or may not need them. It becomes even more important for us to empower today's doctor to become a well-trained clinician, to be able to use their own eyes, hands, ears, and brain when they see a patient to make a diagnosis.
Yeah, I never thought of thinking it that way, because lately, you know, it's like, this is the first doctor in Florida to do this. Right. This is the first time this has been done. Right. And then we live in this social media wheel that's always spinning, and the same thing's happening, but getting back to the basics, what you were first trained with, you know, listening, seeing, touch. We hear a lot of that. I have a lot of DOs on this show. You're an MD, but still, though, they're always talk about touch and manipulation. Right. Getting the hands on the body to kind of...
Well, I was very blessed. I was trained by an icon in the art of cardiology and the art of clinical medicine named Proctor Harvey. And he taught us a very basic five-finger approach to the art of taking care of a patient. The 5 fingers were the history, the patient's story, the physical exam, what to look for, what to listen for when you focus on the patient, the electrocardiogram and the EKG and the non-invasive and invasive lab tests that are available, putting them together in a selective fashion, you have a fist to make a very powerful way to diagnose and treat heart disease.
Those are all the tools in your toolbox right there.
Right.
You don't need any of that new stuff. We're here with Dr. Michael Chizner. He's an interventional cardiologist, general cardiology as well, correct,
Yes,
Dr. Chizner?
clinical and interventional, yes.
He's in Fort Lauderdale. Part of the Broward Health Network. You're on staff at Broward Health Hospitals. Long time, and we're going to get into that. But since you mentioned it, you have there on the table a stethoscope, but this is a little different. If you'll just lift it up, Dr. Chizner, and show the camera. This is a 3-sided stethoscope, so I guess you can really use your senses with that one, huh?
Well, this is actually called the Harvey stethoscope, which was invented by my mentor, Proctor Harvey. And it's basically a very valuable instrument. Unfortunately, in this era of high technology, we have all these tests. The forgotten instrument has become the stethoscope. We see it every day, draped around the neck of almost every healthcare professional walking in the halls of every hospital. But unfortunately, what the national surveys are telling us is that it's becoming a lost art. And they're no longer able to use a stethoscope to make a diagnosis just with their own ears and their senses, whereas yesteryear, the master clinician teachers could look at a patient, listen to a patient, and make a diagnosis and know what was wrong. In fact, today I'll give you another example of that. We were called by the emergency room one day, and the electrocardiogram of a patient with chest pain said the patient's having a heart attack. They wanted to know if the cath lab was ready to rush the patient up to the cath lab to open up what they thought was a blocked artery with a stent. As it turns out, when you talk to the patient was not having that typical pressure type feeling of a heart attack. Their pain was more lying down, better sitting up, worse when they were breathing. And when you listened with a stethoscope, instead of hearing lup-dup, lup-dup, you can actually hear the music of the heart of pericarditis, inflammation of the lining around the heart. That patient did not need to be rushed unnecessarily to the cath lab. That patient did not need a balloon or a stent. That patient was not having a plaque rupture or a heart attack. That patient just needed medication to calm the inflammation. And had they been in a rural hospital where they didn't have a cath lab, that patient could have succumbed to given blood thinners unnecessarily, where they could have hemorrhaged and not been a good outcome.
Oh, no, yeah. So a few things I took away from there. You're talking about focusing on the patient, looking into their eyes, talking to them, using all your senses rather than your head down in a paper here checking off boxes. Or what's going on nowadays is the doctors are all trying to get to the screen and fill out all these boxes, this and that.
So I think what's most unfortunate, David, you hit on a very important point, is I could probably identify for you several things that have tried to take us away from patient-centered care, which is most unfortunate. Number one is that the master clinician teachers of yesteryear have become a vanishing breed. They've passed on. I'm basically a hologram. I'm an aberration. I'm still around. I'm the youngest of the old generation and the oldest of the new. The technology, like a child when they get a new toy, has been so fascinating to today's millennial. They'll rush to it, as opposed to recognizing the importance of clinical skills. They'll think clinical skills are mundane, no longer necessary, rest in peace stethoscope. Not true. Because they're not being taught the art, to no fault of their own, they're ordering test upon test because they're afraid they're going to miss something. From a malpractice standpoint, defensive medicine, malpractice litigation, but tests could be giving you wrong information. And incorrect information, misleading information, could be worse than no information at times. In addition to all that, what's really gotten in the way is that the managed care company now wants the volume. Get them in, get them out. Instead of spending time with the patient, there's no financial incentive to spend time like we are right now, talking to someone, getting the story, examining, slow it down. Instead, you'll be reimbursed by the test. And then finally, as you identified, the computer screen became the eye patient. So there's no real patient. The real patient is an emoji for the eye patient. And now we're doing no longer bedside rounds, we're doing computer rounds. And the computer screen has gotten in the way of the contact between the doctor and the patient, unfortunately.
And that's the balance between the business of it and care that we're
That's
kind
right.
of suffering from
That's right.
now. We're here with Dr. Michael Chizner. He's an MD. He is he has his own office, but he's also on staff at Broward Health, so the great Broward Health Hospitals. Dr. Chizner's office is 12 Northeast 12th Avenue in Fort Lauderdale. His number is 754-779-7150, and we'll give that out again before the end of the program. But he's a world-renowned cardiologist, professor, author, editor, and teacher. He focuses on humanism and hands-on patient-centered care. And I wanted to maybe wait till the break to get to the book, but let's go ahead now. While I'm taking a look at this and bringing this up, tell us where you've been a professor at. You were telling me all 6 universities in the state system?
Well, I'm blessed to be full professor
Here's
at
the book, if you can see it on Facebook and YouTube, Clinical Cardiology. But just, sorry to interrupt, start with
not
that.
at all. I've been academic my whole life as well as clinical, and I'm a full professor at all the universities in the state of Florida, University of Miami, University of Florida, FAU, FIU, Nova, and Barry University, and do a lot of teaching and education, and been involved with long time with instruction of medical students and residents and fellows and nurses, nurse practitioners, physician assistants, and all kinds of healthcare professionals over my lifetime. It's been a passion of mine. The book, the genesis of the book was to try to provide a vehicle that could be clear, concise, easy to read, readily accessible of the basics of general cardiology, and simplify it in such a way that it could be enjoyable reading and be something that everyone can resort to, even the lay public. And I've been blessed to say that this book is the #1 book used in med schools in the country. It's the #1 book on Amazon in cardiology, and I'm very proud of it.
And it's called Clinical Cardiology. It's the 5th edition, made ridiculously simple. That's your trademark there.
Right.
I like that. And right on the cover, I don't know if listeners are going to try to imagine this because the viewers can see it, but there's that lub-dub you were giving us before, the rhythm
Right.
of the heart of the condition you were looking for. And what's really neat is in the back, there's this CD, and it's Heart Sounds and Images. Tell us a little bit about that.
So the CD is basically the vehicle where I basically can vocalize all the sounds and the murmurs of the heart to bring to life all the clinical stories of the patients for learners to understand, and it can supplement the text so they can prepare for their board examinations or course study and basically become ace of hearts in doing so.
That's great because some people, it's not all about visual all the time or reading. Sometimes, you have to use your ears to learn as well.
Right.
And that's what you're using it every day as you treat people across South Florida. How long have you been down here in South Florida running a cardiology practice?
I've been a practicing cardiologist now for more than 30 years in Broward County.
Oh, wow. Well, thank you for your service. That's
Sure,
great.
thank you.
Boy, it's grown in the last 30 years.
It sure has.
It's one of the biggest counties in Florida as well. We love Broward County, and because we're right on the county line here as well. Excuse me. I'm just getting over something, so I'm about in the 11th day here, so hopefully it's going to wane soon, but I'm glad to be here talking, the latest and greatest in healthcare with you about cardiology.
Thank you.
We have about 20 seconds to our break, so I'll just give out your info one more time, and on the other side, we'll talk about a few other topics as well, your beliefs and philosophy and cardiology a little bit more, but Dr. Chizner is located at 12 Northeast 12th Avenue, Fort Lauderdale. Number 754-779-7150 as well. Take a quick break, and on the other side, we'll ask Dr. Chizner some more questions on cardiology on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Yeah, you can every once in a while. Well, we're back. Hello, South Florida and beyond. Welcome back. We're here with Dr. Michael Chizner. He's a cardiologist and interventional cardiologist in Fort Lauderdale, as well as a professor and an author. We were talking about his book, Clinical Cardiology. You were telling me that it's the #1 selling book for people studying medicine?
In cardiology.
In cardiology.
Yes.
Where can people find it?
In any med school in the country, on Amazon, on all
It's on Amazon.
on all the sites. Yes. Any book site. Yes.
And I was just looking at it during the break, and the pictures are really neat in there. And I really like the CD because I'm kind of an audio guy.
Very nice.
I play a little guitar on the side, so
Yeah.
I like that aspect of learning too.
Sure.
It kind of gets me away from my day. That's what I look forward to at the end of the evening there as well. So I was asking Dr. Chizner a little bit about, getting back to the basics in cardiology. He's high touch. He's definitely uses high tech when it's needed, but he'll go into the toolbox that he learned medicine with. The senses, the sight, the hearing, as well as touch as well. I wanted to ask you a little bit about your office. Take us so people may be driving around and listening on the radio or listening in their earphones. Take us through the front door of your office. What makes it a little different than a normal doctor's office?
Well, we're in the heart of downtown Fort Lauderdale, but it's also a very homey environment and very homey atmosphere, and it's very hands-on and very personalized, and we have wonderful staff, Stephanie and Kelly, who just really care very deeply about the patients and their welfare, and it's just a very warm, compassionate, caring environment, very much old school, old traditional kind of medical practice.
That's what I like to see, because that kind of takes the edge off. You don't want to be waiting where you kind of feel like just a number. You want the doctor to come out and ask you your name,
right,
or talk to you in that kind of tone. Know your name, not just a number.
Right.
So that's what you have there in Fort Lauderdale. The address is 12 Northeast 12th Avenue, and you said that's the heart of downtown Fort Lauderdale.
Yes, it's right off of Broward Boulevard in East Fort Lauderdale. Yes.
Oh yeah, I know where that is. That's a great area. What are the 2 sayings that you have on your desk?
Those are 2 very important sayings. The first one is, no one cares how much you know until they know how much you care. And the other one, which I think is the credo that I really live by on a daily basis, is cure if you can, alleviate if you cannot, but always comfort and support, and never ever take away hope.
Oh, those are great sayings to live by, definitely. What's the most interesting story you have as a cardiologist?
Well, I think the story that I could relate to you that is very similar to what I just translated to you about not giving away hope started more than 30 years ago. When I first arrived in the scene, one of the cardiology surgeons came up to me and said, "Michael, would you be able to take care of a patient's friend of mine who was at another outlying hospital? She was told that she has a very, very end-stage heart problem, a very weak heart, and that she should get her affairs in order. She only had 2 or 3 days left to live." And I said, "I'm very honored that you thought so highly of me to help, but it's highly unlikely I'll give you any new medical input with the testing they did. But I'll be happy to help you if you want to transfer her for emotional support, for TLC, for compassion and care. He said, thank you, Michael. I'd really appreciate it. And David, I remember when she arrived at Broward, it was on a Tuesday at 2:30 in the afternoon. She looked so ill. It was very sad. She looked like a concentration camp victim with kwashiorkor, belly filled with fluid. And I said, how am I going to help this poor woman? I introduced myself to her. I said, I'm Dr. Chizner. And I was listening to her and talking to her, trying to look for the clinical signs and symptoms one would have with an end-stage heart, a heart condition that they said she had. And I heard none of it. Because normally what you'll hear is leaky heart valves, and certain classic sounds called gallop sounds from a weak heart. She had none of it. Instead, with her neck veins standing up at attention like a rope, she only had one extra sound, and then all of a sudden, it clicked in my brain. She could possibly have a totally different condition than they thought of, where the lining, again, around the heart, the pericardium was constricting the heart so the heart couldn't do its function, and the fluid was building up, but not because the heart was weak. And I said to the surgeon, if she has that condition, if we take her to surgery and remove the lining, we might be able to help her. And he looked at me stunned and said, Michael, how's she going to survive? I said, I understand, but if she doesn't, she will only have a couple of days to live. So with the help of her children, we all decided to go, and I joined him to the operating room. We were there for 14 hours, literally scraping the matted adherent pericardium like an orange peel from her heart. Once we did this, David, within 2 weeks, everything got better. She walked out of the hospital a brand new woman. The story gets better. She comes back a year and a half later with totally different symptoms in her belly. They do a house MD workup. They biopsy something. They give a special stain. They said she had a rare disease called Whipple's disease. I wondered if she could have always had this all along, and called a pathologist and said, did you save the tissue around the heart? He said, yes, Michael. I said, would you put the stain on and let me know if it's positive? He said, yes, I'll call you in the afternoon. He did. It was positive. So this woman had this rare disease all along with the rare complication of constrictive pericarditis. For 25 years, I would tell her story to every lecture I would give to a medical student, to a resident, to the public, to the fellows, to anyone. And after 25 years of telling the story purposely to highlight the importance of clinical skills and the lost art in not only helping make a diagnosis, but in this case, saving a life when the so-called cutting-edge technology of the time didn't quite cut it. After 25 years, all of a sudden a letter comes on my desk. Dear Dr. Chizner, it's been 25 years since you've heard from me. I'll be 75 this November. I've seen 3 beautiful daughters grow into 3 lovely women. I have 4 beautiful grandchildren. You were just a young boy starting your career, but with determination, perseverance, compassion, and care, you and your colleagues diagnosed my problem and saved my life. I was so moved I cried. I called her on the phone. I said, where have you been all these years? She says, I've been just fine, and I haven't had to see anyone all this time.
Wow, you not only saved her life, you extended it and then gave her back quality of life to share with her family.
Thank you.
And that's what it's all about, that hands-on, personalized approach. And that is a testimonial right there. I've written a lot of testimonials in my day, but I don't think I could come up with anything like that. That's great. That is fantastic.
Thank you.
So, Dr. Chizner, again, I'll give out his info, but he's a world-renowned cardiologist, professor, author. We talked a lot about the book. That is a really neat book, Clinical Cardiology. Cardiology students use it. It's actually the #1 book that's used in teaching cardiology, and it's available on Amazon as well. I just want to give out the info because I want to remember myself. I may go and grab it because there's a lot of great info in there as well. I enjoy reading about medicine. You know, I'm not in the field. Well, I'm in the PR part of the field. But
that's great.
It's good to know. But I wanted to ask you, as a cardiologist, when you're listening with the stethoscope, we're talking about all these latest minimally invasive treatments for atrial fibrillation, the TAVR. I was doing a TAVR testimonial this morning. So that's a new thing, the Watchman device. But when you're in the office and you're listening to the patient's heart, what are you listening for? You're listening for a little maybe irregularity?
So it's music, and I call this the music of the heart. So different conditions have different music. So if someone is having chest pressure, tightness, shortness of breath, dizzy, and instead of hearing lup, dup, you hear dup. That's a valve called the aortic valve becoming narrowed, aortic stenosis. And that person could benefit from TAVR or the minimally invasive way of opening the valve and replacing the valve with a new valve, or traditional surgery or minimally invasive surgery. If a different person came in with chest pain and now it radiated to the back and all of a sudden you hear that's a leaky valve that suddenly occurred. That's the clue or the telltale sign of a tear or a dissection of the aorta that needs emergency surgery, or their life could be gone within an hour. Someone else could come in with leaky mitral valve, and if it's severe enough, they may need the mitral clip or the repair or the replacement of a valve. So the clue comes from the discussion of the history, the listening with the stethoscope, the art of medicine to get you into the appropriate use of technology and treatment.
That's why it's so important for people to go to their checkups, not only primary care, but if they're with a cardiologist, whatever those checkups are, because the heart can change at any time, right?
Right.
We were talking, we started this conversation before we were on air. It could be congenital
Yes.
as well. You could be born with it. We don't fear, we have about a minute left with that music starting. I want to give out your info one more time, Dr. Chizner. 12 Northeast 12th Avenue in the heart of downtown Fort Lauderdale is where Dr. Chizner's office is. 754-779-7150. Hard to believe we went through a whole half hour, but thanks for all the info and talking to us about the book
It was great.
and taking us back, getting back to the basics in cardiology.
Thank you, David. Really
So we'll have to
appreciate
have
it.
you on again in the future.
Love it.
Thank
Thank you
you.
so much.
Thank you, South Florida. That was great. I thought.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.